Living with mental disorders is extremely challenging and demanding. Many experience a wide range of symptoms that makes completing ordinary tasks difficult. This is definitely true for people who suffer from OCD or OCPD. We tend to throw around these terms as casual excuses for our behavior, but actually living with these disorders is much more serious and detrimental. Not to mention, both these disorders are misunderstood and poorly distinguished from one another. Most people believe that OCD and OCPD are pretty much the same disorder because of their names, but in reality, they do not share as much common ground as you would think. So what makes them so different? Let's first look into the characteristics of each disorder. Let's start with OCD. Obsessive-Compulsive disorder comes down to two main parts: obsessions and compulsions. Obsessions are unwanted and intrusive thoughts, images, and urges that one cannot get out of their head. This happens over and over again, and even though the person knows that these obsessions are irrational, they cannot control it. The second part is compulsions. Compulsions are repetitive behaviors and rituals that must follow rigid rules closely. Compulsions are a way to counteract and reduce the anxiety caused by the obsessions, but they only offer temporary escapes. You're probably wondering how OCD is diagnosed. According to DSM-5, one has to qualify for 4 criteria. First is the presence of obsessions and/or compulsions. Second is that these obsessions or compulsions must be time-consuming and cause severe problems in social and other vital activities of functioning. Third is that the condition of the disorder is not the consequence of unrelated medications, drug abuse, or mental state. Lastly, the disturbance is not better explained by the symptoms of another mental disorder. Now, what about OCPD? Obsessive-Compulsive Personality Disorder belongs to a specific group of mental disorders called personality disorders. OCPD is characterized by extreme insistence on rules, orders, lists, and detailed organization, essentially an over-perfectionism that takes control over the person's life. Individuals with OCPD set such high standards and rigid rules for themselves that any variation in their rules and their surrounding is not tolerable. To be diagnosed with OCPD, one has to qualify for at least 4 of the following 8 criteria: preoccupation with details so much that the purpose of the activity is lost, over-perfectionism that interferes with daily tasks, excessive dedication to work at the expense of any other activities, moral and ethical inflexibility, inability to dispose of worthless objects, reluctant in cooperating and delegating tasks, general lack of spending for self and others, and intense rigidity and stubbornness. Now that we have looked at some of their characteristics, we have some good background to understand their major differences. The most important difference is that they belong to 2 different mental disorder groups. OCD belongs to anxiety disorders, while OCPD belongs to personality disorders. People with OCD are always under severe distress and fear because of their intrusive obsessions. For example, fear of contamination and asymmetry. Most importantly, the person is usually aware of their irrational thoughts and understands that this anxiety has no logical basis. Despite this, it's the intensity of the anxiety and obsessions that forces the person to perform compulsions for relief, such as excessive hand-washing or repeating sentences and tasks. But again, this is just temporary and the whole cycle will start over and over again. On the other hand, OCPD is not driven by cyclic intrusive thoughts, but by perfectionism. Individuals with OCPD tend to be unaware of their own perfectionism and obsession with detail. This lack of self-awareness is actually what makes the 2 disorders so different. People with OCPD view their thoughts as part of who they are, see their methods as the only correct way, may find pleasure or benefit in completing compulsive tasks, and may see their perfectionism as a good thing, so they're more likely to not seek treatment. They're also unaware that the people around them are annoyed or frustrated with their behavior, and their inflexible and rigid behavior may cause them to face more issues in the workplace than people with OCD. For example, their tendency to spend an irrational amount of time on details and meeting their own rigid criteria and projects can lead them to actually never finishing the project in time, and also annoying their coworkers and bosses. Furthermore, people with OCPD have such an extreme set of standards that everyone around them must also comply with no compromise. For example, something as simple as washing the dishes should be done in a very specific manner, and any alternative suggestion is forbidden. This can make the people around them feel oppressed or emotionally abused. Their inflexibility towards opposition also means that they're easily hurt by criticism. Any small criticism can be deemed as an attack on them and their correct methods. Their lack of self-awareness, as well as stubbornness, can totally damage their long-term relationships more than people with OCD, creating friction, frustration, and grudges. Conversely, self-awareness in people with OCD allows them to possibly hide or mask their compulsions when in a social situation, even if it's a highly stressful one. They can also avoid situations that will trigger their obsession or compulsion. For example, an individual with fear of contamination may avoid public places like restaurants, or even if the asymmetry of the food on their plate at a friend's house causes them severe anxiety, they may bring up an excuse as to why they do not want to eat it, because they know that their thoughts are not rational. As mentioned, the lack of self-awareness in people with OCPD means that they're much less likely to seek treatment than people with OCD. Nonetheless, people with OCPD as well as OCD can hugely benefit from a variety of different treatments, such as medications, psychotherapy, or other alternatives. If you or a loved one is suffering from OCD or OCPD, or if you would like to learn more about them, please make sure to check out the resources provided on screen or in the description for more guidance.